Picture this. It is 2 in the morning. You are sound asleep, finally getting the rest your body needs. And then it hits. A sudden, vicious, white-hot cramp seizes your calf muscle with a grip so tight and so painful that you bolt upright in bed, gasping. You press your foot against the floor, massage the muscle desperately, and wait for what feels like an eternity for the spasm to release. If you are a senior and this scenario sounds painfully familiar, you are not alone. Nighttime leg cramps affect an estimated 50 to 60% of adults over 60. And for many of them, these cramps happen not once a week, but multiple times a night, every single night, slowly destroying their sleep, their energy, and their quality of life. Most doctors hand out a standard list of suggestions. Stay hydrated, stretch before bed, eat a banana. And while those tips have some merit, they almost never address the true root cause. Because the real reason most seniors suffer from chronic leg cramps, weak legs, and poor lower body circulation comes down to a single vitamin that the majority of older adults are profoundly deficient in. And that vitamin is vitamin B12. Once you understand what B12 deficiency does to the nerves, the muscles, and the blood vessels of the legs, everything changes. Why this problem is so widespread after 60. Vitamin B12 deficiency among seniors is one of the most common and most consistently overlooked nutritional crises in modern medicine. Studies published in the American Journal of Clinical Nutrition estimate that anywhere from 10 to 30% of adults over 60 are deficient in B12, and that number climbs to nearly 40% in adults over 80. The reason is not primarily dietary. Most seniors eat enough B12-containing foods. The problem is absorption. Vitamin B12 requires a specialized protein called intrinsic factor, produced by the stomach lining, to be absorbed into the bloodstream. As we age, the stomach lining gradually thins and produces less stomach acid and less intrinsic factor. This condition, known as atrophic gastritis, is estimated to affect up to 30% of older adults and dramatically reduces the body's ability to extract B12 from food, no matter how much of it you eat. The problem is made significantly worse by medications that are extraordinarily common among seniors. Metformin, one of the most widely prescribed diabetes medications in the world, is well documented to deplete B12 levels with prolonged use. Proton pump inhibitors and H2 blockers, taken daily by millions of older adults for acid reflux and heartburn, further reduce stomach acid and impair B12 absorption. And antacids, which many seniors use casually and frequently without a prescription, compound the problem. The tragic irony is that many seniors are taking the very medications that are silently draining the nutrient their legs, nerves, and muscles need most, without any warning from their prescribing physician. What vitamin B12 actually does in the body. To understand why B12 deficiency wreaks such specific havoc on the legs of older adults, you need to understand what this vitamin actually does at the cellular and neurological level. Vitamin B12 is essential for the production of myelin, the protective fatty sheath that surrounds and insulates every nerve fiber in the body. Think of myelin as the rubber coating on an electrical wire. When myelin is intact and healthy, nerve signals travel rapidly, accurately, and efficiently from the brain and spinal cord to every muscle in the body, including the muscles of the legs, calves, and feet. When B12 levels fall and myelin production is compromised, those nerve fibers begin to degrade. The insulation cracks and wears thin. Nerve signals become erratic, misfiring, and distorted. In the legs, this manifests as a predictable and deeply distressing constellation of symptoms. The muscles receive scrambled signals from damaged nerves and respond with involuntary, painful spasms, what we experience as cramps. The sensory nerves that carry information about touch, temperature, and position back to the brain begin to malfunction, producing the tingling, numbness, and burning sensations that many seniors describe in their feet and lower legs, a condition formerly known as peripheral neuropathy. Balance becomes impaired because the nerves that track where the body is in space, the proprioceptive nerves, are among the first to suffer from B12 deficiency. And muscle weakness in the legs sets in because the motor nerves that activate muscle contractions can no longer do their job reliably. This is not a problem that stretching will fix. This is a neurological crisis driven by a nutritional deficiency, and it responds dramatically to nutritional correction. The circulation connection. Beyond its role in myelin production, vitamin B12 plays a second critical role in leg health that is equally important and even less widely understood. B12 is one of three B vitamins, alongside B6 and folate, that are essential for regulating homocysteine levels in the blood. Homocysteine is a naturally occurring amino acid produced during normal metabolic processes. In healthy amounts, it is harmless. But when B12 levels fall, homocysteine cannot be properly converted and metabolized, and it begins to accumulate in the bloodstream. Elevated homocysteine is one of the most well-established independent risk factors for cardiovascular disease, and its effect on the blood vessels of the legs is particularly significant. High homocysteine directly damages the inner lining of blood vessels, the endothelium, causing inflammation, reduced elasticity, and impaired dilation. In the legs, this translates to reduced circulation, slower delivery of oxygen and nutrients to the muscles, increased susceptibility to blood clots, and the painful cramping and heaviness that many seniors describe after walking even short distances, a condition known as claudication. Research published in the journal Circulation has shown that correcting B12 deficiency and normalizing homocysteine levels significantly improves endothelial function and blood flow in peripheral blood vessels. In simple terms, restoring B12 levels literally opens up the blood vessels in the legs, improving circulation, reducing cramping, and restoring the strength and comfort of movement that seniors thought they had lost forever to aging. The red blood cell factor. There is a third mechanism through which B12 deficiency devastates leg health, and it operates at the level of the blood itself. Vitamin B12 is absolutely essential for the production of healthy red blood cells. When B12 is deficient, red blood cells are produced in an abnormal, oversized form that cannot carry oxygen efficiently and cannot navigate the smallest blood vessels, the capillaries, that supply the muscles of the legs and feet. This condition is called megaloblastic anemia, and it produces a very specific and recognizable set of symptoms in the legs. The muscles feel perpetually heavy, weak, and exhausted even after minimal activity. They cramp more easily because they are chronically oxygen deprived. Recovery after walking or exercise is slow and incomplete. The legs feel as though they are carrying lead weights. Many seniors attribute this exhaustion and heaviness entirely to age. But in a significant proportion of cases, it is B12 deficiency producing abnormal red blood cells that cannot properly oxygenate the very muscles the person is depending on to stay mobile and independent. The signs. Your legs are telling you. Your legs are often the first and most vocal part of your body to signal a developing B12 deficiency, long before the deficiency becomes severe enough to show up dramatically on a standard blood test. If you experience frequent nighttime leg cramps that wake you from sleep, persistent tingling or numbness in your feet or toes, a burning sensation in your calves or soles, unusual weakness in your legs when climbing stairs or rising from a chair, a feeling of unsteadiness or poor balance when walking, or legs that feel disproportionately heavy and fatigued after modest activity. Any one of these symptoms in isolation warrants a conversation with your doctor about your B12 status. Together, they paint a picture that experienced clinicians increasingly recognize as classic B12 deficiency neuropathy. The diagnostic test is straightforward. A simple blood test measuring serum B12 and, for even greater accuracy, methylmalonic acid and homocysteine levels, which become elevated before serum B12 drops enough to register as clinically deficient on standard lab ranges. How to restore B12 and transform your leg health. The good news, and it is genuinely outstanding news, is that B12 deficiency is one of the most correctable nutritional deficiencies in existence. Once identified and properly addressed, many of its effects on the nerves, muscles, and circulation of the legs can be partially or even fully reversed, particularly when caught before the neurological damage becomes advanced. The approach to correction depends on the severity of the deficiency and its underlying cause. For seniors with mild to moderate deficiency related to reduced dietary intake or medication interference, high-dose oral B12 supplementation is often highly effective. Research has shown that doses of 1,000 micrograms or more of oral B12 daily can restore adequate blood levels even in people with reduced intrinsic factor production. Because at very high oral doses, a small percentage of B12 is absorbed through passive diffusion across the gut lining, bypassing the intrinsic factor pathway entirely. For seniors with more severe deficiency or with confirmed atrophic gastritis, intramuscular B12 injections administered by a healthcare provider deliver the vitamin directly into the bloodstream with 100% bioavailability, bypassing the digestive system entirely. Many seniors who begin B12 injections report dramatic improvements in leg cramps, nerve sensations, energy levels, and balance within weeks of starting treatment. Results that genuinely shock both patients and their physicians who had previously attributed these symptoms to irreversible aging. The best dietary sources of B12 include clams and shellfish, which have extraordinarily high B12 concentrations, as well as beef liver, sardines, salmon, tuna, eggs, and dairy products. For seniors following plant-based diets, B12 supplementation is not optional. It is an absolute necessity, as B12 is found almost exclusively in animal-derived foods. Fortified nutritional yeast and certain fortified plant milks provide some B12, but typically not at levels sufficient to correct an existing deficiency without additional supplementation. Supporting nutrients that amplify B12's effects. While B12 is the central player in this story, it works most powerfully in combination with several complementary nutrients. Magnesium is essential for muscle relaxation. It is the mineral that allows a contracted muscle to let go. And magnesium deficiency is itself a significant contributor to leg cramps in seniors. Taking B12 alongside a daily magnesium glycinate supplement creates a powerful dual approach to cramp prevention that addresses both the neurological and the muscular dimensions of the problem. Vitamin D is critical for muscle fiber function and neuromuscular coordination, and its deficiency compounds the leg weakness and balance problems caused by B12 insufficiency. Folate, vitamin B9, works in direct partnership with B12 in the homocysteine metabolism pathway, and the two should ideally be addressed together for maximum cardiovascular and neurological benefit. And potassium, found abundantly in bananas, sweet potatoes, avocados, and leafy greens, supports the electrical gradients across muscle cell membranes that prevent spontaneous cramping. Together, these nutrients form a comprehensive nutritional foundation for strong, cramp-free, well-circulated legs in seniors. Motivational conclusion. Waking up in pain in the middle of the night, shuffling slowly because your legs feel weak and unreliable, watching your independence quietly shrink because walking has become uncomfortable. None of this is the inevitable destiny of aging. For a significant proportion of seniors experiencing these exact struggles, the answer is not a pharmaceutical drug, not an expensive procedure, and not resignation. It is a vitamin. A single, inexpensive, extraordinarily well-studied vitamin that the aging body increasingly struggles to absorb, that common medications silently deplete, and that the legs are crying out for every single day. Ask your doctor to check your B12 levels. Advocate for yourself, and know that the strength, the comfort, and the freedom of movement you remember are not necessarily gone. They may simply be waiting for you to give your body what it has been missing all along.